age is affected by PCOS. It's a common infertility diagnosis, and today on Lunchtime Live with the Center, Dr. Reeva Makhijani is back to share some helpful information on PCOS and take your questions as well. Welcome back, Dr. Makhijani.
Thanks for having me.
So what is PCOS? Let's start there.
So PCOS stands for polycystic ovary syndrome, and it is a very common disorder among women of reproductive age. Like you already mentioned, it affects around 1 out of every 10 women in that age group. And basically what it is that there's a imbalance of reproductive hormones, which usually leads to irregular periods. It can lead to metabolic issues as well as problems like acne or unwanted hair growth.
And is there a cause for it?
The cause is really not well understood, but it is thought that it's partially genetic and certainly more common in certain ethnic groups. And if you have a family member that is affected, like a mother or sister or first cousin, then you are also more likely to have it.
And can you talk a little bit about how would someone really know that they had it? Is it something that requires a diagnosis?
Yeah, so it's a diagnosis of exclusion, and many women really don't know they have it until, they see their doctor because they've been either having irregular periods or they're interested in becoming pregnant and are having trouble because PCOS is also a very common cause of one of the most common causes of infertility.
Oh, really? So can you talk a little bit more about what the symptoms are or even how you diagnose it?
Sure. So, in terms of the diagnosis, we, have a criteria that we use to diagnose, and like I mentioned, that it's a diagnosis of exclusion. So, typically, we take a medical history, and women with PCOS often complain of irregular periods that are usually happening less than 8 times a year. Your cycles could be short, less than 21 days, or long, more than 35 days. Women often also report like hair growth on their face. They may report acne or thinning of the hair on the scalp. And if you see a gynecologist, sometimes they'll send you for an ultrasound, and the ovaries may appear polycystic on ultrasound, which means that there's lots of little follicles or little eggs inside of the ovary that you can see on ultrasound. And then you have to also evaluate for other conditions that might look similar to PCOS. And once you've ruled all of those other possibilities out, then you make the diagnosis.
Okay. And how does it affect a woman's ability to conceive? Why is it an issue with polycystic ovaries?
Right. Yeah, great question. So, like I mentioned, women with PCOS typically have irregular periods. And the reason for that is because the hormonal imbalance that I mentioned prevents them from ovulating regularly, or in other words, releasing an egg each month. And if you don't ovulate, then you can't become pregnant. So that is the reason why these women typically have trouble conceiving.
And how can advanced reproductive technologies, what options do we have for women with PCOS?
Sure. So, even before doing any kind of treatment, what we typically recommend is just lifestyle modifications with diet and exercise, because many women with PCOS have trouble with weight, and we know from good data that even a very modest reduction in weight can often result in spontaneous ovulation, which can help these women get pregnant on their own. However, in the event that they're still having trouble, we have many excellent options available to them. The simplest being giving them a medication, a pill, typically something called letrozole, which they take for 5 days during their cycle, which helps them to recruit and ovulate an egg like they're supposed to be doing.
Okay. And so would that mean that they could also they could get pregnant with something like IUI, or does the person need to have IVF if they are diagnosed with PCOS?
So they don't necessarily have to do either,
Okay.
it depends on the situation, but sometimes they can just take the medication and then time intercourse appropriately because we've helped them to ovulate.
Ah,
Other times, if they want a little bit of extra help, then we can combine the medication with an appropriately timed insemination. And then, if they've done multiple cycles of IUIs that have been unfortunately unsuccessful, then we can absolutely do IVF, and women with PCOS do great with that line of treatment as well.
you had mentioned a little bit about some lifestyle changes. Um, what are some other day-to-day ways that patients can manage their symptoms of PCOS?
In terms of fertility specifically, really lifestyle, diet, and exercise are the mainstay of treatment. However, for women who are not at this time trying to get pregnant, then the options typically include some kind of hormonal contraceptive, not for the purposes exactly of preventing pregnancy, but for the purposes of regulating their cycles.
Okay.
And then there are also some adjunctive medications we sometimes prescribe to help with the increased hair growth that they might complain of, like on the face or chest.
Okay. And you had mentioned that a lot of women with PCOS have insulin resistance. Is that is everybody have insulin resistance if they have PCOS?
Excellent question. So, for the people who out there who may not know what insulin resistance
Hmm.
is. So, insulin is a hormone that our bodies make to regulate blood glucose. So, basically, it causes the sugar to go from your blood back into cells. And women or people who are insulin resistant don't respond to insulin normally. So, higher amounts of insulin need to be made in order to regulate blood sugar. So that is much more common, certainly in women with PCOS, but it doesn't affect everyone. It's probably around 30 to 40% of all women, and especially and even higher in those who are um, obese as well.
Okay. All right. Well, thank you for being here and sharing about PCOS. It's PCOS Awareness Month, and we certainly wanted to talk about that.
Yep, no problem. Happy to do it.
And we will see you next time on Lunchtime Live with the Center. If you have any questions, comments, concerns, or just would like to learn a little bit more, please check out our website at yukonfertility.com. And we will see you next time. Bye for now.
Bye.